Hi everyone, welcome. And today I am joined by Mandy. Mandy, thank you so much for your time. I always say this, but honestly, time is my most precious commodity. So I appreciate when people make time for me. And I appreciate you with your willingness and your openness to have this conversation with us today on Voice of Champions. I'm going to jump straight into question one, if you don't mind, and ask you just to give anybody who's listening at home some insight into who is Mandy and why are you so passionate about menstrual health and girl-based issues.
Yeah, well, thank you so much for having me, Quincy. Like I said to you, talking about menstrual health is my passion and a big part of my life. So I'm so happy to be here. My name is Mandikudza Tembo. I am a PhD research fellow. So I'm studying a PhD in menstrual health. I'm based in Zimbabwe, but I'm doing my work with the Biomedical Research and Training Institute and the London School of Hygiene and Tropical Medicine. I like to call myself a Afro-feminist. I am very passionate about women's issues, particularly women in Africa. I think there's so much to talk about, so much to learn actually from the movement in Africa. And being an African woman myself, obviously have a personal connection to the content and to the movement. And yeah, I'm just happy to be here, happy to contribute to this conversation. I'm also the sort of founder of the Bleed Read, which is an online platform that celebrates and amplifies the voices of menstruators around the world. And you can obviously find us on Instagram and on Twitter. And we have a blog where we just talk about all things menstruation related.
Oh, Mandy, I love that so much. You said, you gave us a word that it made me kind of like tingle all up inside because I'm all about everything African. I'm all about women issues. And you said, you are an Afro-feminist and your passion really lies within Africa and the issues that are facing women in Africa. And I think that is so important because your work is literally focused on trying to have more open conversations. And so is your blog, right? The Bleed Read. It's
Yeah.
about really opening up those conversations. Can you maybe tell us in what regions do you particularly do your work or your research?
Yeah, so I've been involved in reproductive research. So everything from STIs to HIV to now menstruation for the past 8 years. My focus of my work right now around menstrual health is in Zimbabwe and particularly around young women and adolescent girls, so 16 to 24. And so that's where I'd say my expertise lie within the sub-Saharan African region. I do a lot of work collaboratively with partners in East Africa and with partners in the UK. But I would say that, like I said, Afrofeminist, the majority of my work is within the sub-Saharan African region. With the Bleed Read, though, I feel like because it is very much a virtual platform and we are trying to be as engaging, as inclusive as possible, I would say that that's a global platform, and that for me, when it comes to representation, giving out information about menstruation, talking about menstruation and making it a normalized conversation in private and public spheres, that is very much a global thing that I do.
Oh, Mandy, I like that. I actually enjoy your blog, by the way. So I do encourage anybody out there in this kind of stuff to go out there and to read it. I think it's so authentic and it just speaks to how we should be having conversations around menstrual health. I want to know now from you, with your research and all the girls that you've spoken to, you mentioned that, you primarily have these conversations with girls between the ages of 16 and 24. What are some of the sort of socioeconomic or perhaps even cultural sort of issues and factors that you've seen that kind of hinder or dictate how a woman experiences her menstruation or her period in sub-Saharan Africa?
Yeah, I mean, it's a really the answer to that question is quite long, but I will try and be as comprehensive as possible. And I guess I would say the biggest informing factors are social cultural norms and restrictions, so resource restrictions. So as many societies and cultures around the world, the biggest thing for women is that periods are very much a privatized issue, very much stigmatized, and very much made to be no one needs to know about it. No one should be talking about it. It is an issue that you deal with by yourself. And so obviously that context and that norm that it is a private issue and it's a secret and it's shameful will inform how you experience periods over time. You won't be able to have conversations with older people. So your parents or an older sister or a caregiver, you won't be able to have that conversation with your peers, so your friends or your sisters. And so you end up going through menarche, so starting your period, really having minimal information about what it is.
Yes.
And when you do tell people about what it is something, the shame and the stigma is reinforced. So often a lot of girls will talk about when they first shared that they had a period, they were told not to play with boys. They were told to, be extra clean, and they were told to keep it a secret. And so when you encounter instances of pain or you do bleed through your clothing, there's very limited places you can get advice. There are very limited resources of which you can engage to see, why is this happening? Is this normal? Is this abnormal? And that in turn, gives way to a lot of anxiety and then a lot of internalized shame, where if I bleed through my clothes, it's my fault and I should be ashamed of it and I can't talk to anyone about it. So that's just sort of from the social norms perspective, which, is widespread, because also our mothers and our older sisters, even if we weren't able to engage in conversation around periods, probably don't know much either, because they didn't have an opportunity to learn about it. And then from a resource limitation, there's limited access to products that work, products of our choice, limited access to medication, access to menstrual health education. And so if you don't have those three things, you are going to be filled with anxiety when it comes to your period, because you're going to remember that, oh, I'm probably going to bleed through my clothing. I probably won't be able to go to school or to work because I'll be in so much pain and I don't know how to manage it. And so those two things are probably the biggest informers of how women experience periods, particularly in low to middle income countries. But even in high income countries, there is a lot of stigma and shame around periods, because period blood is considered dirty or impure. And it affects your quality of life if you know that if people know I'm on my period, I can't worship in my place of worship. I can't engage with my friends. There's certain things that I can't do, or in some cases in the world, I'm told to go stay somewhere far away for a while, or to isolate myself for a while.
Yes. Yeah. You're isolated from everybody else when you're on your cycle.
Yeah. And it's physically, right? But it's also mentally, right? Because you're going through so many things, but you don't feel like you can share that with people. And when you do, the feedback is often negative, whether that's from a partner, or a parent or a friend, right? Like, oh, why are you telling me that? Or, it's your period, you're being extra, or you're being too much, or
or you're being gross. It's like, I don't want to hear that.
I don't want to know.
Yes, I don't want to know that you're bleeding right now. And I mean, I'm pulling a face, as you're talking, because that's what it feels like for me. It's not just the physical isolation when a woman is on her cycle or when a young girl is on her cycle, but it's that, those socio-cultural norms that you mentioned. And I think it's so important to focus on that just for a second, is how conversations are initiated with young girls when they first start their cycle, right? I think for a lot of us who come from different countries, more developed countries, and also who went to like sort of middle class based schools, we had a different sort of initiation to it. If we didn't have the conversation at home, we certainly had the conversation at school through sex education, or whatever the class was called at that time, either life orientation or sex education. And then we had or we heard it from our friends at school who were like, who were kind of proud of it. It was the weirdest thing for me. I was like itching. I couldn't wait for my cycle to come, because all my friends had already for me, and they were
same.
And it seemed like something that they were kind of like, yo, this is what's happening with us now. We're grown now, right? But it was still a scary thing, because at that point, nobody explained what it actually means. So when you bleed for the first time and you see that blood for the first time, you literally think you're dying. And I think this is like the sign of really the disconnect and the gap with what I think maybe boys or men don't understand, that it's actually a traumatic experience. And I can't imagine then what that's like if you don't have that level of support, if you don't have somebody who has a conversation with you and
Yeah.
positions it in a positive way for you, right? If you
Yeah.
start, like I said, if you start on a shameful sort of footing regarding your menstrual health, can you tell us what that effect actually has? You mentioned anxiety and you mentioned stress. I just feel like as women, we have so much already to deal with. And it breaks my heart that this is another thing that is
Yeah.
making young girls in Africa feel ashamed of themselves and ashamed of their bodies. And in your work and in your interaction with these girls, what has been the mental and the psychological impact, if any, that you've noticed in the way these conversations are introduced?
Yeah, so that's a really, really good question, because I think people think that if you've had a bad experience when you started your period, there are ways that you can, you can move past it. But it has long-term implications, especially if you're not intentional about the unlearning that you've experienced in when you got your period. But first, I want to say that I think these conversations around periods need to start happening a lot earlier than when you first have your period. Right?
Right?
It should be, yeah. Let's start when when kids are in infancy. And I'm not saying talk to them about reproduction, but definitely have a conversation around knowing your body, knowing your body parts, and then moving to what your different body parts do, and talking about, oh, when is it that I should tell you if something is wrong with my body, right? So as a child, you should be able to come to a parent or a caregiver and say, this is sore, or I went to the bathroom and this happened and it's never happened before. In a more serious circumstance, it didn't feel good. That kind of dialogue really starts from giving your children or young people, empowering them about speaking about their body and knowing what their body does. So I want to say that the conversation start early. Obviously, it progresses over time. But I think when you have a bad experience at Menaki, when you have a negative experience from just yourself and not knowing what's happening, it really can carry on into adulthood, where you are very secretive about your period. And there are lots of women that I've encountered that, experience severe pain and severe bleeding. But because they've never been able to speak about menstruation in general, they're not able to express that to a friend, let alone a medical professional. And so there are a lot of women who are suffering with conditions that are very much manageable or can be alleviated through medical intervention, but they will never engage in conversation about what they're experiencing. And so they suffer in silence. And then obviously physically, if your body is telling you something is wrong and you're not able to express that to someone who can help, your condition is deteriorating every single day. So they definitely, particularly around young people who are engaging and getting to know themselves sexually as well, there are instances where they will leave it until they cannot walk, or until they're in a position where they're trying to have children and they're not able to over a prolonged time to seek intervention. And at that point, a lot of medical professionals will say, why didn't you come to me when you saw this type of discharge, or when you saw this on your vulva? And it's because often the answer is, I didn't know I could. I was afraid, and I didn't know that was abnormal. And then other times it's, I never look down there. I never engage. I don't actively engage with my period to know that, okay, it used to be 5 days for the past 5 years and now it's 10 days. That means something is wrong. Or I never used to get clots and now I'm seeing clots. Could that be an indication of something else?
Yeah.
So I'm always encouraging people to get in touch with your menstruation and get in touch with your body, so that you're able to decipher what's normal versus abnormal for you.
And you touched on something so important in your answer, and I promise there were so many gems in that answer. But something that you touched on was that we need to have these conversations a lot earlier, but that doesn't mean we're having the reproductive conversations. That doesn't mean education. Like your period is something that really can be taught in isolation to the sex conversation. And I think that's why you even sort of made it clear at the beginning in your introduction that you research menstrual health and reproductive health, right? Those are two separate kind of, I don't know, we want to call them buckets right now, right? For lack of a better word. And I think that's where the unease comes in. And that's why it's so important for us to have these conversations, especially with our parents, is they think if we're going to talk about your period, because it's about a body part that is considered private and that is considered something that you shame away from, that it's just going to somehow sort of, give a rise to our appetite to sex. And that's not necessarily the case. And I think this
No.
misconception about our cycles is really what is causing all of these issues that you mentioned, where girls don't interact with their bodies or their periods. They don't talk about it when something is wrong. The shame of it. I think of my cycle in particular was extremely heavy growing up, right? Extremely heavy. The charts that you're mentioning, the heaviness, the pain, the crippling pain, right? But even though my mom could see this, and even though my mom, could see that, okay, my child is not okay during her cycle, it's one of those things where you're taught, push through the pain, right? Here's a
Yeah.
Panado for you, push through the pain, you're going to be okay. But
or everyone experiences it.
Yes, but instinctively, that something is not right. And the sad thing is that I only started to gain control over my own cycle once I left home and I went to university and I was able to see a doctor on my own without my parents in the room, like without my parents there kind of dictating how the conversation goes with my doctor. And I think that's such a key point you're mentioning, to say, girls, do we even have access to speak to medical professionals on our own without our parents there that might have a different perception to what our cycles are? And it was only once I had that conversation that I was able to control and feel like I had some control with my cycle and get treatment for it, so that it's not this excruciating experience every month. And I think for me that point is just so important. Were there any other kind of stigmas or misconceptions, especially within the regions that you're working on, that make it difficult for young girls to sort of even pick products? You mentioned, what a big thing about your blog is to make sure, and your research is to make sure that girls know that they have product choices. Are there any particular stigmas as well in terms of that kind of dictate how a girl gets access to whatever sanitary, products that she needs, but also the choice?
Okay, yeah. So I wanted to hit on something you said earlier on, this idea that people are really afraid to talk about menstrual health because they automatically assume it leads to talking about sex. And so menstrual health is a key component of reproductive health because it involves the reproductive system. But I think that menstrual health should be understood as a sort of a pinnacle in terms of the life cycle of a woman and the menstrual cycle of a woman, and that it has to be spoken about quite early on so that you are preparing people for what's to come. We don't have to talk about sex. We're literally just talking about body autonomy, understanding what's in your body, why it works, and all of that. And then as time goes on, we can talk about the other things. And so I think I wanted to just sort of agree with you and say there's a lot of stigma around menstruation because it's sexualized, but starting a period doesn't mean that you are a sexual person or that you're ready to engage in sex. It's just your body growing, and that sex aspect can come much later on.
I feel like we need a moment of silence because you definitely need to repeat that. And I think that is such an important aspect of it. And I thank you for putting it in terms that actually make sense instead of my bucket analogy. Say that again, Mandy, for everyone at the back to hear.
Yeah, starting your period does not mean you're ready to get engaged in sex. It is a part of your body preparing for what's to come. But the sexualization of menstruation is very much a thing in a lot of cultures that needs to be broken down and deconstructed and unlearned.
Like drop mic kind of moment, because I think that is, you laugh, but I mean, it is really important. Absolutely. Because I feel like, and you're right, and you use the right word there to say the sexualization of our period is actually the issue. It's actually part of the bigger problem, and why we can't talk about it, and why we can't get the kind of help that we need, and why there are all of these taboos and stigmas around it. I love how you summarize that completely. I think we can now go on to the second part of that question, which was, what sort of informs a girl's choice of the products that she uses? we've had a conversation before, and I thought that was so interesting in your research around that. Firstly, access, right? Access is still important. It's what does she actually have in front of her to use? But in time, you mentioned that it's so important to note that, you know, we go through life. I mean, from the time you're maybe 10 or 11 when you start your cycle to the time you're 20 or 30 or 40, you might not be using the same type of products. Can you maybe just run us through what you have found in your research regarding that?
Yeah, so a big part of our research that we're doing is really looking at informed choice. And that is a particularly like unique term, I feel like, in menstrual health research, because I think people often talk about acceptance of products, and they say, we gave this product to 100 women and they all took it up. But the informed aspect is quite important. Did you explain what is available to them? So all the products that are on the market, how they work, if they're usable, how you wash them, how you use them over time, because all of those things should inform the decision-making process that a woman or a menstruator makes. And so I think predominantly the research that we're doing in Zimbabwe, the biggest thing is access, right? What is actually available in my community? And then what can I afford of that which is available? So the amount that something costs to use over time is a huge informing action of that, because I don't think that should limit how or why a woman chooses a product that they choose. They should be able to choose whatever product works for them, regardless of the price. And for that to happen, the price needs to be affordable for all. In an ideal world, free.
Ideally.
But other informing factors are the type of work that you do. So a big thing that came through at the times of COVID are women or menstruators that worked during COVID as health workers. And so you're wearing your PPE, you are working 10, 12 hours in a day. You really don't have the time to change a product every 3 hours, every 6 hours. So you want a product that's long lasting. So depending on the work that you do, you decide on a product. Depending on your age and your culture and social norms and beliefs, that also informs your product. So one product we have in our study is the menstrual cup. And one thing that we found is that, you know, we talked a lot about the cup. We talked a lot about how it's used and how it works. But what was persistent or in our community in terms of how people thought about the menstrual cup was that it's something that you insert in the body, and they weren't quite comfortable with that and how it might affect the hymen and, you know, to a bigger part, someone's virginity, especially if they're younger. And so that definitely plays into the product that you can use. And I think I could, you know, talk for days about menstrual cups and the barriers and, you know, how you can surpass them, but how sometimes it's beyond your control. And there's a need to give adequate information so people can make a choice for themselves. And then another aspect is, you know, if you've given, you know, your lifestyle, you know, what do you do in a day? Do you travel a lot? Do you swim a lot? And so if you're a swimmer, I don't think your menstrual cycle should prevent you from doing what you need to do. And so there are a lot of things that inform the product that you choose. And I think what I found in the research is across the board, people have limited information about the products that are out there, let alone how they work. And so if they don't know what's out there, how it works and how it can help or improve their life or their lifestyle, I just think it's unfair. And what I've tried to do, at least with the Bleed Read, is to disseminate as much information about the options that are available. And in that sort of play my part in making sure that people have the information. Not everyone will have the resources, and that's sort of out of the scope of the work that I can do. But if I can tell you what's out there and you can think about it and decide this works best for me and have the resources to get that, that's a little bit in terms of, you know, allowing all women to have informed choice when it comes to menstrual products.
And you're right, it is a sad thing. It's a sad thing to think that, you know, women actually have all of these products. And I think that, you know, that choice is also informed by, like you mentioned, the information that's available to us. It's the adverts we see on TV. It's basically what is advertised more is what informs a choice. So I love the fact that your research covers all of that. It covers all of that. But mostly what I really enjoy about your research, Mandy, is that there is a follow-up aspect to what you're doing.
Yeah.
And I think that's so important. You touched on it a little bit when you said, organizations go out there and they throw 100 products or 100 pads out there and they go, this is great. We have given, right? We have distributed, we have given, but is anybody doing the follow-up? And why is the follow-up so important?
Yeah. Very, very good question, and something that's been quite nuanced or novel in the work that we are doing is that we are following up with our participants that come to our service we've been doing that for the last 2 years. And so, like I said, there are a lot of papers out there that speak to the acceptability of products and say, we went into this community and we offered them this free product and everyone took it up, so it's 100% acceptable. But uptake does not necessitate use, right? If you're coming to an environment where there's a huge need for menstrual products, which is actually, to be fair, a big part of this, the globe, let alone the sub-Saharan African region, someone is going to take it because it's free. Will that person necessarily use it is another question. And so what our research does is we offer a choice of products. And we say, based on the research, it takes at least 3 cycles to get used to a product that maybe you've never used before.
Oh, that's interesting.
And so, so at least 3 cycles to get used to something quite novel and new. And if after those 3 months, you still feel like this product doesn't work for you, and within those 3 months, we offer a lot of support, a lot of feedback. If you have to come back and say, this happened, or how do I do this? We are there to support and help you in person and over WhatsApp or virtually. And then it's, if you still feel that way after 3 months, you can bring your old product back and then you can get a new product. And, just to speak to the need in our communities, the reason we spoke about bringing back your old product was just really so that we know you've not given it to a cousin or you've sold it to someone, because everybody needs support. And just to give context, our study is only focused on 16 to 24-year-olds. So we know that, people below and above that age range need support. And we completely understand that, that need can necessitate a participant giving a product to someone else. So we just ask you to bring it back, we incinerate it, and then we can give you the alternative product in its place. And from that, we're able to assess, does uptake actually result in someone using that product over time? And there, just speaking to the reason why this research is important is around, if you give people information, what choice do they make? But outside of your engagement with that individual, they have to go back home to a family or to a partner. And so how does that interaction within a community setting inform how they continue to feel about their period and the product that they're using? And just speaking around the menstrual cup, you might have a great conversation with individual and they would love the product and they're willing to try it, but they might have a very negative feedback when they go back into the community. And that can, force them to come back and say, what, I know what we talked about, but it's a no from me. And that's a very real thing that I think providers and implementers need to be aware of, that when you engage with menstrual health, as much as it is something that happens to one individual, it is very much informed by a whole community. And any intervention needs to address, social cultural norms and context in addressing menstrual health. And, this kind of platform where we're able to share what we've learned from experiences in the field and in our work is a great platform for people not to have to learn it for themselves, right? So, lessons learned from what we've done, so that you can preemptively arrange or, navigate how you implement your program or do your work, preemptively address issues of virginity and the hymen, preemptively, make sure that you're including community members and partners in an intervention addressing menstrual health, and preemptively giving out information that will allow for women to make a choice for themselves.
And I think that's exactly, you hit it right on the nail on the head. Is that's exactly what we're trying to do with these conversations. Is we really also want to ensure that in our work that we're encompassing all of those things that you guys have spent decades, right, gathering and understanding, because we don't want to just focus on giving that one girl a product and kind of move off. We are about support and sustainability. And it's important
Yeah.
that we understand all of the factors and all the aspects that kind of inform product choice, first of all, but also how that girl is going to be using our product. And it's such an important aspect because we talk about this all the time within our own team. We talk about this all the time, and how we're going to engage the community into this
Yeah.
conversation to demystify and destigmatize menstrual health as well, but the use of the product. How are we going to engage
Yeah.
parents or guardians that they're living with? Because we also know there needs to be an intergenerational conversation as well that has to happen.
Yes.
A lot of the girls don't necessarily even live with their biological parents. They live with uncles or
Yeah.
aunts or grannies or grandpas. And we have to be cognizant of all of the factors that are surrounding them that will inform how they use the product as well. Not just, oh, this is cool, this is a free product. Thank you so much. I'm going to take it now because it's free. And we are like in
Exactly.
the are all about that, and just safety as well, making sure that how they're using the
Yes.
product.
Safety.
Yes, how they're using the product is also safe. And it's so funny that you mentioned, you guys ask for your products back, because we were just talking about that now, to say we need to make sure that with every kit we're giving, if you've got a sister at home who's going to start a cycle, please don't share. Come back and tell us, and we will make sure that
Yes.
your
Yeah.
sister also has her own kit, so that we can keep everything clean and hygienic, and we can
Yeah.
also teach
Yeah.
her and
Yeah. Yeah.
yeah, it's a lot of stuff to think about. It's not just about handing over kits and going, well, thank you
No,
so much. there's
not
there's
at
a lot
all.
of,
Yeah.
and that brings me to my next question, which is, our campaign is about keeping girls in school, and we're trying to close
Yeah.
that gap between when a girl is on her period and she's not able to go to school. What have been some of the consequences that you've noticed, or the consequences that, to you, are some of the biggest consequences to a girl not staying in school?
Yeah, I mean, I think education across the spectrum is a firm foundation for, what could be a a good and fulfilled life, right? It is the cornerstone of entering into the job sector. And so there, within the Zimbabwean context, particularly, if girls are not able to stay in school, what they often do is get into early child marriage. Already that's, a negative in and of itself, but once they are within that marriage, then they are going to be childbearing, much earlier than when their body is prepared for.
Yeah.
And that can have medical implications in terms of, stillbirths or deformities or fistulas once the birth has occurred. Another thing that we've seen quite predominantly in Zimbabwe, and I know there's been studies in Kenya about this as well, is that it becomes an exchange for menstrual products. So you engage in transactional sex so that you can find the finances to facilitate your periods. That's something that is very well documented, and there are quite a few papers about that. And that's also because within the household, menstruation is not considered a priority. And so a lot of parents, even knowing what happens outside of the home, will say, why did you leave that person you were with, because they were able to provide that for you? We can't provide that within the household. So again, the idea that women will end up staying in very violent or harmful
And toxic
relationships.
environments, yes.
Yeah, because it facilitates a need that they have, which is they need financial resources to manage their period all the time. And you can just think about this, the reproductive implications of that, of engaging in relationships that you don't have any sort of power over.
Yeah.
In engaging in early child marriage, we're talking about, risk to infection, HIV and STIs. And an environment like Zimbabwe, where it's very hard for you to get tested or get treatment for any sexually infected infection, you're then leading on to issues of infertility later on in life, because you may have had, chlamydia or gonorrhea for years, but because you didn't have access or capability to get tested, or because you engaged in this activity from quite a young age where that's not something you're thinking about, you are now in a position where you can do nothing about it. So there are a lot of implications health-wise that come from that. And then also a lot of implications economy-wise, right? If you're not able to continue with your schooling, or your work might be interrupted, right? So let's say you've been working for a while and you still don't have access to products or to pain management. You're missing work, and there are very few employers who will understand that you're missing work because of your period. And you're always falling behind in terms of the ladder of progression. And so there's also that negative, that you might lose your job or stay stagnant in the position that you are because you're missing out on work or activities because of your period. And those are just sort of the, things that you can directly link to menstruation. But there are a lot more long-term implications that affect the individual, affect the family, and ultimately the well-being of like a nation or global well-being because of what's happening to women with regards to menstruation.
That's precisely the point, is that these girls, they're not just girls. They are literally holding within them the future of that community, generations that are going to come after them, of our spaces, right? Those are the next doctors and economists and teachers, and those are our next architects and mothers. And it's so much bigger, I think, when people stop to actually think about the magnitude of a girl missing that crucial step in her journey and the implications of all of that. And I'm so grateful for how you have literally surmised all of that, from the economic impact, from the generational impact, right? And just linking it and also making it very clear that those points that you mentioned were just direct links to menstruation, right?
There are a lot of indirects. Yes,
we're not even digging deeper into that. I mean, education for me is extremely important. I think anybody who knows me or knows my story knows this, right? And it's the very reason why I started Hello Coach K, because I believe that education is a key and is a tool to gaining your financial freedom and your economic freedom. And you mentioned things like child marriages and girls having to exchange themselves for sanitary pads. And that's devastating to me. And education really is the way to do that. I know it's not a singular tool. There has to be support, right? There still has to be so many other mechanisms around that. But if we're able to gift girls with full access to education, at least at that stage of their lives, then we're having a different conversation, right? Then we're having, it becomes a completely different conversation. It becomes a completely different journey for them as well. And we've spoken about the devastating consequences, and they make me so sad. I try not to harp on them too much, because I'm like, this conversation is actually a good conversation to have, because we're doing the work and we're trying to resolve this issue, right? But that brings me now to the next question, which I am excited to ask you, because I can't wait to hear what your answer is. But we've spoken about the consequences. What does it mean to you? You're somebody who's been on the ground working with girls now for a long time, and you've seen the consequences, and you've also seen the impact, the positive impact of keeping a girl in school, of helping her through her menstruation and her journey. What does that feel like for you? What did it mean for you to gift a girl with that, with period freedom, with keeping her in school?
Yeah, that's a really great question. I mean, it is such a joy and an honor, particularly as a Zimbabwean woman, to be, to be engaged in menstrual health work in the region. For me, being able to keep girls in school, being able to give young women information so that they are empowered within themselves and they're not ashamed for being menstruators and for having a period. And part of my work also engages young men, and there's a lot of pride in seeing young men talk about periods and talk to their classmates or their friends and chastise them for shaming girls for bleeding. It's just an amazing feeling. And then also doing this work has been really great because I've met amazing people across the world who are doing different forms of engagement, advocacy, and education, and just realizing that while there's so much work to be done, it's not something that we are doing by ourselves. We're constantly engaging with partners across the world who are doing amazing work in their different spheres. And that's very, very encouraging. Because like you said, it's not just about, this period of menstruation, but we are empowering, generations of women who will then empower others, either through the ability to continue going to school and then going to work, or engaging in conversations with just their friends and their family, right? There's so much to be gained from feeling like I don't need to keep my period or my experience a secret at work or at school or at home. And I can have pride in who I am as a menstruator. And with that voice, I can, proliferate change. I know so many friends who've been able to incorporate sanitary bins or menstrual leave or, period positive dialogue and language at work and at school. And that's a huge part of what we're trying to do, normalize periods and make sure that anyone who has a period is able to do so comfortably at any stage of their lives. And it's, it's grown to the point where medical professionals are taking interest and keen interest and to say, I need to know more about periods, because that's not something that, as much as we like to think that that's something all doctors know, it's not something that most medical professionals know about. I think there are experiences across the board from probably a lot of the people that will watch this who will talk about how they talked about pain and their doctor just said, this is what it is. Or, oh, heavy bleeding, that's normal. And now we have the medical profession taking a listen and really being like, okay, how can we best facilitate good menstrual experiences for women across the globe? And so for me, I'm doing my little bit, but knowing that I'm part of a much bigger team makes me really excited and happy.
Oh, you know what? You touched on another topic and I thought that's an interview for another day, how the medical professions actually don't know much about this and what's going on in a woman's body and how to actually manage pain. But for now, Mandy, honestly, thank you so much for your time. That leaves me with one last question for you. And that is, how can anybody watching at home who is maybe being ignited by your work, who wants to know more about your research or who wants to get a hold of your blog? I know you mentioned it a little at the beginning, but please let them know how they can get a hold of you.
Okay, so like I said, I curate the Bleed Read and we can be found at www.thebleedread.com. And so we really address anything reproductive health aligned, everything from menstruation to free bleeding to contraception and things you consider when making a choice around contraception. You can also find us on IG, so that's Instagram or Twitter at The Bleed Read. And then you can find my professional profile where you can absolutely shoot me an email and we can talk more about the work that I do and collaborating on projects that you might be doing at Mandikudza.Tembo. And if you want to look a little bit more at our research work with menstrual products within Zimbabwe, you can find a full profile of what we do at www.chiedza, which is chiedza.co.zw.
Thank you for watching this episode of our series, The Voice of Champions. If you also want to make an impact and become a Million Girls Champion, then visit our website at amilliongirlsfoundation.org and help us keep a million girls in school.